I'm Beth Farrell. Welcome to the show. It's National Prostate Cancer Awareness Month, and we'll be talking about that with Dr. Richard Lotenfoe. He is with Urology Health Solutions, a practice in Celebration. Doctor, why don't we begin by setting the stage? How significant is prostate cancer? How many people are affected?
Yes, Beth. Thank you very much for having me. I feel honored to be here. Absolutely, prostate cancer is still a large problem. It is one of the major causes of cancer and death in men still. And there is a significant amount of men that will be diagnosed with prostate cancer. And there's still a significant amount of men this year that are projected to die of prostate cancer. So it is very important to get the screening process continuing. All men are affected. There are some differences as far as ethnicity is concerned, but all men are affected with it, and the projections are that 198,000 men will be diagnosed with prostate cancer in this year, and 28,000 are projected to die of the disease this year. Now, it is still a large amount of men. However, about a decade ago, about 45,000 men were dying of prostate cancer. And that is about when we started doing the screenings every year. And I think that the screenings, in spite of the fact that studies have come out that question the validity of screenings, that we are doing something. The amount of patients dying of prostate cancer has really gone down significantly.
And so you really do attribute that to the fact that men are getting in, they're having the test, and they're recognizing this at an earlier stage of the cancer?
That's correct. In the past, prostate cancer was only diagnosed in late stages because it can give symptoms only when it is in an advanced stage. And men were diagnosed at high ages like 70, 80, and at that time, often it was already advanced. Nowadays, we diagnose it at earlier ages, and we can treat it easier. The smaller we get the cancer, the easier it is to treat.
So when we spoke about a moment ago, all men, when it really comes down to it, though, do all men of all ages and all ethnicities wind up being somebody who tests positive? Or is there a certain age group or something?
Yes. The highest risk factor, the biggest risk factor for prostate cancer really is age. And until several years ago, we started screening patients at age 50. Nowadays, because we actually see cancer at earlier ages, we started screening at age 40. Since last year, we started the screening process at age 40. We recommend that every man over the age of 40 gets a screening done at least annually.
What is the screening like?
The screening itself is really not very enduring. Basically, what we do, we have to feel for the prostate. We can do that through the rectum. So you get what we call a finger wave or a digital rectal exam. The doctor with usually small fingers puts his finger in the rectum and feels for the prostate and feels for the consistency of the prostate and the size of the prostate. And that is one indication that may may show any abnormalities. And the second part of the test is a blood test called the PSA. The PSA stands for prostate-specific antigen, and it is a protein that is excreted by prostate cells. And if it is elevated, it may indicate cancer. However, PSA is prostate-specific. It's not prostate cancer-specific, and an elevated PSA does not necessarily mean that you have cancer.
So if that happens, you proceed to something else?
Exactly. If that happens, then we go look a little further. It will tell us that we may need to look further. Now, there's one caveat that I need to say is that we have determined that the level of PSA, there is no certain level that excludes cancer. So let's say that somebody has an abnormal exam with the finger exam and the PSA is low. That does not mean that he does not have prostate cancer. That's why we need to look at both together and then decide on whether we proceed further with any further diagnostic procedures.
But once a year, just getting that screening is a safe bet for men.
Exactly. Exactly. It is a relatively small thing to do. It doesn't take much time. And especially in September nowadays, there are many institutions, such as hospitals, but also doctors' offices, that provide these prostate screenings, and in most cases for free or at a very nominal fee.
And for example, I know in your office, you're not going to set aside a special day or anything like that, but you're allowing people to kind of come in and you'll wedge them into the schedule and just do the screening and get people on their way.
It is traditionally you'll have like a health fair on one specific day or one specific morning, and everybody shows up for that, and it is not always convenient for people. So I try to modify that and think that, over the month of September, and we're going to extend it probably into October, that patients can either walk by the office or make an appointment with the office, and we'll see them, we'll do the screening in between the regular patients. So they don't have to sign in, they don't have to show an insurance card, they don't have a copay, they just have to fill out the screening form, and then we'll work them in between the regular patients and do the screening. The screening itself takes only a few minutes.
Now, tell me about men and how comfortable they are setting up this kind of screening.
They are not. It is, they see it as not, well, there's almost no man that sees it as macho as going to the doctor. That is almost as conceding defeat. And it is usually, or very often, the wives that send the patients to the doctor.
I can attest to that in our family.
Exactly. And that's a typical scenario. And, we see it all the time. It is not a big thing. Also, thinking about, well, what is the doctor going to do? That finger exam, of course, and then the blood drawing. And then they're thinking, well, what if something is abnormal? Then what? And what is going to happen? And, and that already starts them with the thought of, well, maybe I just don't want to go to the doctor yet. I'm not ready yet. But that's kind of putting your head in the sand. Take that first step. It is really not a bad experience. It is mostly the anticipation and anxiety, but it can save your life. And, think also of your loved ones, because if you're not around, well, it's the loved ones that suffer.
I kind of equate this to a woman getting a mammogram or something else. It isn't comfortable maybe, but it's just something you do because it can really help you identify something significant.
Yes, compared to a mammogram or even a pap smear, this is really much less intense than that. It is really much less intense than that. For the mammogram, there's a lot more discomfort involved really than that digital exam and the blood test. Many women also don't really enjoy the pap smear, and I can really speak from my family how that goes about. But women tend to be more steadfast and say, I'm taking care of myself and have it done. And, we're trying to get across and make it easy for men to come along as well and do the same thing for themselves.
Well, tell me what they tell you when they finally do get in the door for an exam. That man who has waited and waited and waited, is it the fear of the exam, or is it what you spoke to earlier, a sense of, I'm giving in if I go to the doctor?
I think it's a combination of all those factors. Fear of going to the doctor, fear of finding something wrong. And then they, of course, like to say, well, I kind of feel fine. I don't have any symptoms. And I encounter that in the office when I see regular patients and they come for some other diagnosis, even potentially a vasectomy or a kidney stone. And I say, well, let's check the prostate. And I find something abnormal. And I say, well, we probably need to do a biopsy testing for prostate cancer. And they say, oh, no, but I feel fine. Well, the whole thing is that, in prostate cancer in early stages, you have no symptoms at all. And usually, like almost any cancer, once you have symptoms, it is usually advanced. And then it is much more difficult to treat.
So are you saying that just by virtue of somebody coming in for something else like a kidney stone, you just wind up finding out that they might have cancer?
It is part of my job to make sure that, even though I'm a specialist, but not to just take care of only a kidney stone. I'm not taking care of a kidney stone. I take care of the whole patient. And of course, I'm somewhat limited because I'm a specialist, but I will try to screen and see if there's anything else with the urinary tract and make sure that everything else is okay.